Okay, magandang hapon. Ang COVID-19 pandemic, kailan nga ba matatapos ito? Ang katanungang ito, ang laging nasa isipan natin, 'di ba? At simula nang manalasa ang nakamamatay na pandemyang ito. Na makatapos po ang Omicron surge noong January 2022, ay nakita naman po natin na talaga naman patuloy na bumaba yung mga kaso, bagay na nagbigay daan upang luwagan ang mga restriksyon dito po sa ating bansa. Tama ba ang desisyong ito? Do we really need to implement itong Alert Level 0? Ano ba yung mga guidelines nito? Para po pag-usapan ang isyung ito, makakasama natin ngayong hapon ay ang fellow sa OCTA Research Group. Walang iba kundi si Professor Guido David. Magandang hapon po, Prof. Maraming salamat sa pagsama sa amin ngayong hapon.
Hi, magandang hapon Angela and sa mga viewers and listeners natin sa inyong programa.
Ayun. Prof, before we move forward dito sa sinasabi natin na new normal, no? Sa kasalukuyan kasi, ayon po dun sa mga naging datos na tinitignan po natin, ang Philippines daw ranks second behind Indonesia. In Southeast Asia, kung pag-uusapan po itong confirmed deaths with 57,000 fatalities, at marami pa po yung mga naging concern dito in 2 years of this pandemic. Factors would include po yung hospitalization rates, yung mga positivity rate, testing capacity. So, what happened? What do you think po, being an expert on this, what happened, no? What do you think went wrong since the pandemic has started? Ano po yung mga supposedly parang dapat na i-considera during that time?
Well, we have to face it. Ngayon, syempre, actually yesterday, 2-year anniversary ng first ECQ natin, first lockdown natin. And at that time, I mean, hindi pa ako na-interview or I wasn't doing any work on COVID. Syempre, bago pala yung COVID, I was just like all the, all our mga kababayans na surprised by the sudden lockdown. It seemed like it was much worse than we thought it was. So at that time, syempre yung data natin, hindi pa, wala pa tayo masyadong database. We did not have experience with SARS or with MERS. And that's part of the reason kung bakit hindi tayo masyadong prepared. Unlike some of our Asian neighbors, prepared na sila. So because of the experience in SARS and MERS, so, ibig sabihin, pagdating ng SARS-CoV-2, which is yung sa COVID-19 nga, prepared na sila. So, meron na silang yung iba may test kits na, meron na silang mga supplies, may mga face masks na silang ready. Tayo, naubusan tayo nun eh. Wala tayong masyadong facilities, even face masks.
Exactly.
Or even alcohol nga, nagkaubusan. If you remember,
yeah, I remember that.
March of 2020. So, hindi tayo masyadong prepared and dahil wala tayong national ID, nahirapan din tayo mag-develop ng centralized contact tracing app, which is very important for pandemic. So, medyo unprepared tayo sa simula. And, medyo kinakabahan natin, which is understandable naman. I'm not blaming anyone kasi it's a learning process naman talaga. Yung ginawa natin sa pandemic. So, in fact, nung umpisa, ang masasabi ko, wala talagang eksperto sa COVID mismo. Kasi bago lang siya. So, we have to face that. Kahit yung mga doctors natin, baka familiar sila sa SARS, pero yung COVID was something new. So, yung knowledge talagang nagtutulungan tayo sa international community. And that's why yung transparency ng data was very important then and even now. Pero, ayun, we had sa NCR, so yung initial surge no March 2020, then the first wave around June, July, this was due to the first variant, yung B1. And then yung sunod na variant, Alpha and Beta, nangyari nung March 2021. And then sumunod naman yung Delta nung August 2021. And then most recently, nung January, ito na yung Omicron. So talagang parang bagyo yan na dumadating siya almost every 3 months. And may relevance din kung bakit bukang 3 months pumapasok yung virus. But I could mention that later. Pero, I think right now, mataas yung deaths natin. And in fact, there's a paper na binabasa ko about estimating yung excess deaths ang sinasabi nila, yung actual number is maybe 4 to 5 times higher than yung reported natin. Yung reported natin nasa mga 50,000 deaths nationwide. So kung totoo yun, baka nasa mga 250,000 deaths talaga ang nangyari sa Pilipinas. I mean, relatively lower siguro compared sa other countries like the US, pero still mataas pa rin yan. And we had lockdowns, we had trials and challenges throughout the pandemic. Talagang na-test talaga tayo, na-test yung resilience nating mga Filipino people. Ang dami na nating naging mga protocols or policies, may mga barriers na in-implement, or even yung sa angkas may plastic barrier, which I thought at that time parang paano makakatulong yan. Pero anyway, I mean, pagsusubok na naman yan.
And naging trial and error, no, along the way.
Parang trial and error talaga. And hindi naman natin, wala naman tayong sinisisi. But right now, at least maganda yung numbers natin for now, and partly because of the resilience developed throughout the pandemic. Dahil nakita natin, pag masyadong maganda yung pandemic management nila, for example, South Korea, or even China, pag tinamaan sila finally ng Omicron, talagang ang sobrang daming cases kasi wala silang resilience. Tayo, may resilience na tayo. So, meron tayong naging advantage din naman kahit na may challenges tayo nung umpisa.
Exactly. And I have to agree with you, Prof, kasi nakita naman natin, although nagkaroon nga ng Omicron surge in January 2022, talagang ang laki, ang taas ng mga cases, hindi na tayo parang nangapa, hindi tayo parang bulag, no, in the middle of the night na hindi natin alam kung ano yung gagawin natin. And, alam natin, systems in place. It's not perfect, but we were able to, push through or pull through. And seeing this decreasing numbers that we have, no, and we have a lot of people to thank for. Kasama po kayo dyan. At syempre yung mga frontliners natin. At saka yung mga hindi pa saway na publiko. Yung mga LGUs na nakakapagpa-implement nitong mga safety protocols natin. But is it a wise decision to place our country at alert level 0? O yung mas maluwag na restriction sa ating bansa? Or better yet, after elections na lang?
Well, I think in-extend naman nila to end of March yung alert level 1, pero still, I mean, may possibility na baka after end of March baka ilagay sa alert level 0. Ang position natin, kahit na mababa yung bilang ng kaso natin, kahit na getting numbers natin, firstly, number 1, yung state of emergency hindi pa nalilift sa Pilipinas. So, pag andyan pa yung state of emergency, kahit na mababa yung bilang ng kaso, kailangan pa rin tayo. Kailangan may pag-iingat pa rin. Kailangan sumunod pa rin tayo sa mga health protocols, particularly yung wearing of face mask. So, yan yung point number 1. Point number 2, yung WHO, hindi pa siya na-declare na tapos na yung pandemic, na nasa endemic tayo. Kahit nabababa yung bilang ng kaso dito, kung mataas pa yung bilang ng kaso sa ibang mga bansa, tulad ng sa China na tumataas ngayon, sa South Korea, 300,000 cases per day. Tapos may mga ibang countries din sa Europe, nagkakaroon ng resurgence ulit, tumataas ulit, kahit na bumaba na sila. So dahil dyan, hindi naman tayo isolated sa rest of the world. So kailangan may pag-iingat pa rin. Kaya mababa yung bilang ng kaso. Kasi, example, nung December, bago pumasok yung Omicron, ang baba na ng bilang ng kaso natin. Ang saya na ng mga tao, nag-Christmas party na tayo. Hundreds of cases per day na lang. Pero dahil nagkaroon ng panibagong variant ng Omicron, at nung nakapasok dito, affected pa rin tayo. Kahit na mataas yung vaccination natin, may mga nagka-COVID pa rin at concerned pa rin yan. Tsaka marami pa rin hindi vaccinated. So yung vaccination, syempre, success naman yan, pero marami pa rin hindi pa bakunado. At kailangan i-priority pa rin natin sila to get vaccinated or to get the boosters. So, dahil sa mga considerations yan, mataas pa yung cases rest of the world, especially in Asia, na malapit lang sa atin yan, mga kapitbahay lang natin yan. Tapos, hindi pa na-declared na endemic, hindi pa na-alis yung state of emergency. I think, kung may scientific basis tayo, yun yung sinusundan namin. Pero, we think na baka it's too early pa to move to alert level 0. Sinusupport naman natin yung economy natin na dagdagan natin capacities para maka-recover tayo economically. Buksan natin yung mga businesses. Pero yung pag-alis ng mga protocols, we think na it should still be here habang nasa state of emergency pa rin tayo at hindi pa na-declare na endemic.
Prof, tama po kayo dyan. And you mentioned earlier that you wanted to say about yung mga, tell us about itong mga, paano pumapasok yung mga COVID-19 variants, etc. No? And also, on our end, we would like to know, paano po ba itong ginagawa ng OCTA Research Group sa inyong mga forecast? Kasi 90% or almost to 100, tama po yung mga forecast na sinasabi nyo. No? Pagdating ng, kunyari, tomorrow, tama, sabi mo, end of the week, ito yung lalabas na number. So, very curious kami to know how you guys do it in your in OCTA Research Group. So, pero bago niyo po sagutin yan, wag po muna kayong aalis dahil magbabalik po ang Istorya Sessions. Welcome back sa ating Istorya Sessions. With us pa rin si Professor Guido David from OCTA Research Group. Prof, ang ating naiwang question kanina, ano po ba yung ginagawa ng OCTA Research Group dun sa inyong mga forecast? Kami po ay very curious about it. And yung kanina pong na-mention nyo about yung mga pagpasok ng mga possible COVID-19 variants in the coming days. Prof.
Yes, Angela. And thank you again. So, itong ginagawa namin, we use data, particularly yung galing sa Department of Health. So, may centralized database ng Department of Health. At base dito, nakikita natin yung mga bilang ng kasos sa isang region and sa buong Pilipinas, yung number of deaths. At ito, pinapasok natin sa isang tinatawag na mathematical model. So, hindi ko mabibigay yung detalye dito. Pero kung interested yung mga viewers and listeners, minsan may mga webinar or minsan nagpa-present ako sa scientific conference. So, in fact, na-present ko na ito for the interested viewer na, na numerically inclined. So, dito sa mga numbers yan nga, dahil ginagamit namin projections, recalibrate namin yan. Medyo na-estimate natin kung ano yung mga magiging bilang ng kaso sa mga susunod na araw, minsan sa susunod na linggo. And ginagawa namin ito since April of 2020. Kaya nga ako na-involved dito kasi nung March, nung nagkaroon ng lockdown, nakita ko yung mga projections at parang hindi ako masyadong well, I mean, since math professor din ako, ginagawa ko rin talaga ito. Parang naisip ko, maybe I could contribute to society, to the public. At sinimulan kong gawin siya. Initially, hindi siya masyado napapansin. Tapos, eventually, napansin siya around mga May and June of 2020 dahil parang tumatama nga yung mga projections. And sa naman sa public naman, kahit hindi nila naintindihan yung methodology, parang yung credibility is earned sa reputation may kung tumatama. Sabi mga 90 to 100%, usually within a range of mga 10%, 20%. So dahil sumasakto siya or tumatama siya, ayun, we gain credibility. So ayun, may gagawin yan except na recently medyo tinigil na yung pag-release ng daily data, so titingnan natin kung how we can access yung data pa rin kung possible. Yung sa mga variants,
yes.
Napansin natin na more or less parang every 3 to 4 months nagkakaroon tayo ng surge. Bakit yun? Kasi may ibang pag-aaral na sinasabi na nagkakaroon ng waning immunity. Ibig sabihin, kahit na vaccinated tayo, bababa yung level of antibodies natin after a period of time. Usually mga 3 months or more, nagkakaroon ng waning immunity. Ganon din pag na-expose tayo. Kasi ngayon, kaya mababa yung numbers natin. Kasi maraming sa mga kababayan natin actually na-expose sa Omicron. At dahil na-expose sila, meron na silang antibodies against Omicron. Pero possible na bumaba itong antibody levels natin after 3 to 4 months. Kaya rin, yung mga nakita natin sa history natin. Yes, nakita natin na yung surge every 3 months nagkakaroon ulit ng surge. totoo yan, it's possible na habang mataas pa yung cases sa labas, after 3 months, kasi nag-surge tayo January. So after mga 3 to 4 months, baka magkakaroon na ng simulang pag-wane ng immunity, and that will happen around April or May.
April.
Na yun. So that's why we're
oh my gosh.
Wag naman sana.
Wag naman sana, diba?
Hindi naman yung prediction na guarantee. Sinasabi lang natin, may risk, may chance na nangyayari yan. At wag naman sana.
Yeah, I understand, and if pagbabasihan natin yung trend, yung numbers and other factors that are involved, may possibility, sabi nyo nga po, no? And seeing these, all of the campaign rallies, 'di ba, mga sorties that we see, no, in another circumstances, kung walang COVID-19, napakaganda. Sabi natin, okay, maraming nakikipag-participate, maraming bumoto or maraming sumusuporta sa kandidato, but this time that we have pandemic na still ongoing, parang personally, I am scared baka magka-surge uli because of these ongoing campaign rallies or sorties.
Definitely, Angela, baka magkaroon ng surge. Kasi, syempre ngayon, kampante tayo. Parang, may mga campaign rallies. Hindi naman nagkakaroon ng surge. So, mas magiging kampante pa tayo. So, isa sa mga malaking protection natin, itong face mask. Kaya nga, we don't recommend na alisin muna natin yung face mask, especially at this time, na marami tayong mga campaign rallies, mga sorties. Kasi sa mga ibang bansa na tinignan ko, nung may election period sila, nung election year nila, nahirapan silang i-contain yung pandemic. So kahit mataas yung vaccination, so mataas yung cases nila. Sa atin, fortunately, mababa dahil nga meron tayong na-acquire na population protection against Omicron. Pero kung totoo yung scientific studies na baka bumababa yung antibody levels after 3 to 4 months, sakto yan sa election natin. Baka sakto yung 3 to 4 months. Baka magkaroon na naman. Hindi naman natin inasa na yung surge ay magiging kasing taas na nangyari noong January, pero still, magkakaroon pa rin ng spike in cases, tataas pa rin. Baka tataas to a few thousands, for example. Marami pa rin ma-affect. And may mga mamamatay pa rin, unfortunately. And isa pa sa mga binabantay natin ngayon, Omicron din siya, pero may sinasabi sila na may sub-variant ng Omicron na ito yung kumakalat sa Hong Kong at marami na patay. So that's why baka ito rin kasing pumasok sa China. So that's why we are monitoring this. So hindi pa natin masasabi na tapos
we're not out of the woods
yet. We're not
out
of the woods yet.
Diba?
We want the economy to be open and we want people to go out, pero we want minimum public health standards. We want boosters. We want vaccinations.
Exactly. And speaking of vaccination, siguro kaya rin yung mga tao malalakas na yung loob pumunta sa mga ganitong crowded areas, specifically itong mga campaign rallies, because they feel that they are protected already because they're vaccinated. But I don't have an actual data here kung ilan na po yung percentage of our population ang nakapag-vaccine na. Pero marami pa rin po, no, na sinasabi nila na may mga hindi pa rin nakakapagpa-vaccine, specifically yung mga malalayong lugar, hindi sila naaabutan ng mga vaccine doon, may mga undecided pa rin, 'di ba? At takot pa rin sila dito sa pagpabakuna. Prof, ano po ba yung magandang gawin? How do we ramp up this vaccination drive? Mag-increase yung numbers?
Yes, and Angela, yun nga, we have to ramp up yung vaccinations natin. Tama ka nga, and based on our surveys, mataas yung hesitancy sa mga rural areas. Yung mga urban areas, okay naman. Yung NCR, Cebu, Davao City. Pero yung mga rural areas, medyo mataas yung hesitancy. Medyo marami pang mga bata na hindi pa vaccinated. This will be a concern pag nabalik yung face-to-face classes sa elementary school, magkakaroon yan ng hawaan kasi lalo ng mga bata, hindi sila marunong magsuot ng face mask. Hindi naman natin mamamonitor yan lagi. So that will definitely be a concern, especially sa mga parents na may mga anak sila na papasok na. Yung mga batang elementary. Kasi kung mga college level, wala naman tayong masyadong concern dahil of age na sila, they know how to wear face mask. Pero pag mga bata, ayun, naglalaro-laro sila, nagpupunta sila. So definitely, ang problem natin is yung current messaging natin, hindi na siya aligned with vaccination. Mahirap na mag-convince ng mga kababayan nating magpabakuna, yung mga hindi pa bakunado, dahil ang messaging is tapos na yung pandemic or, pawala lang. I mean, mababa yung numbers natin. Pero we have to reiterate na hindi pa tapos yung pandemic. The more na mas, pag mas maraming bakunado or may boosters, mas mataas yung protection natin, mas maliit yung chance na magkakaroon ng resurgence na kinakatakutan natin. So itong resurgence na ito, hindi naman prediction yan, pero it's a risk na posibleng mangyari at mas maliit yung possibility na mangyari yan kung vaccinated tayo at nagsusuot tayo ng face mask. Pero kung hindi tayo kung ayaw na magpabakuna ng mga kababayan natin, tumataas yung risk na magkaroon ng resurgence ulit.
Resurgence, oo nga. Nako, Prof, I have a lot of questions pa, but break muna tayo. Huwag po kayong aalis at magbabalik pa po ang Istorya Sessions, of course, with Professor Guido David. All right, and we are back here. Still joining with us is Professor Guido David from OCTA Research Group. Prof, new normal na. How are we gonna live in the future? Do we see ourselves taking our mask off? Diba? Yung sinasabi nila na alert level 0. Ano po ba yung, may idea na po ba tayo sa guidelines? Prof?
Well, yung alert level 0 specifically, hindi ko pa nabasa yung specific guidelines nito kung ano yung magiging mga protocols. At since hindi pa siya na-implement this March, well, baka ma-implement siya by April, so we'll see. So, yun nga, I'm not sure kung na-publish yung guidelines nito. But I would imagine na yung face masks, baka mawawala na siya at some point in the future. And I know naman, marami nang pagod magsuot ng face mask. I mean, yung face shields na wala na. Pero I think this has to be a gradual process. Yung wala nang yung hindi na pag-require ng face mask. If ever magsisimula to siguro sa outdoors. For example, yung mga nagjo-jogging, yung mga nasa park. Kasi pag outdoors naman at hindi kumpul-kumpulan, maliit lang naman yung risk. This is scientific.
Yes,
pero kung outdoors na dikit-dikit sila sa campaign rallies, I think kailangan pa rin yung face mask.
Ibang usapan na yan.
Ibang usapan yun. Kasi pag dikit-dikit tayo, kahit na outdoors, andyan pa rin yung risk talaga na transmission. Exactly. At kung may isa lang doon may dalang COVID or kunyari may bagong variant na pumasok, huwag naman sana, pero let's say may most likely marami siyang mahahawaan. Kung assuming hindi na rin na magkaroon ng resurgence at panibagong variant, at hopefully tuloy na, then we can definitely move to the new normal. Ito, yun nga, yung mga protocols natin
in place pa rin.
Pero gradually baka ma-roll back yung ibang protocols. Kasi ngayon sa alert level 1,
100% capacity.
100%. So wala na physical distancing. Paano kung mag-physical distancing? Kung
exactly.
Diba? Kung sa bus, 100% capacity. It means dikit-dikit na yung mga tao. Kung sa restaurants, 100% capacity. Dikit-dikit na yung mga tao. And yung mga plastic barriers, sa mga restaurants, sa mga groceries. Nakita ko wala na eh. Wala na, oo. So tinanggal na yung requirement for plastic barriers eh. Andiyan pa bing requirement for vaccination? Wala na rin. So ibig sabihin, vaccinated, unvaccinated, pwedeng sasakay ng public transportation, dikit-dikit na. So wala na yung social distancing. So that's why we think na yung face mask should be at least there in place. Maybe until after elections or until the cases subside further, until nawala ng cases worldwide, then we can think of it. Pero yung in terms of economic activity, I think wala nang halos bawal ngayon eh. Even mga social gatherings, hindi na pinagbabawal yung mga yan. So it can be done na. So para na tayo rin halos nasa new normal eh. Yun lang nga, new normal, pero andyan pa rin yung safety protocols and andyan pa rin sana yung reminders sa public na andyan pa rin yung virus. There's a chance na babalik ito. Wag sana. So that's why we should still be prepared. Parang bagyo, tapos lumipas na yung bagyo, pero baka may susunod pang bagyo, di ba? Hindi natin masasabi.
Yun, I agree with that, Prof. And it's good that you mention yung public, kasi data may show numbers are down, decreasing. LGUs and the rest of the government may say prepared sila. Ito yung ginawa nila, ito yung mga protocols, etc. Prepared sila sa pagbaba ng restriction. But are we really ready for this mentally? No? Tayo, publiko, handa na ba? Should we return back to normal? Or yun nga, tulad ng sinabi mo, dapat guarded pa rin tayo. Prof, what do you think about this?
Well, and I agree, Angela, na ayun nga, I mean, numbers are good, but we don't want the risk na bumalik yung cases, lalo na kung may panibagong variant. Hindi pa natin ma-predict yung mga variants na yan kung magkakaroon pa ng panibagong variant So that's why we should be prepared. We should be using the time to prepare ourselves. Tayo ba? Ready na ba tayo for alert level 0 for the new normal? Over the past 2 years, hindi pa natin nakita ito. In fact, yung alert level 1 over the past 2 years, first time natin ma-experience yan nitong March lang, February, March. So, ibig sabihin, ready na ba yung mga kababayan natin? Meron pa rin siyempre yung mga natatakot. Meron mga kababayan tayo, hindi pa sila na-expose sa COVID kasi maraming na-expose na, pero pwede pa rin bumalik yan. We have other considerations. Hindi lang naman yung COVID Kung may mga natatakot magka-COVID at paranoid sila ng mga kababayan natin, hindi ko sila masisisi kasi may other factors. Kasi sinasabi na, okay, we should live with a virus. Treat this like flu. But can we treat this like flu? Is it the same as flu? Kahit nasabi natin, okay, mababa naman yung deaths, mababa na yung hospitalizations dahil maraming vaccinated. But there are other considerations kasi merong yung sinasabi siya, conditions sa mga bata or yung long COVID na tinatawag which affects maybe up to 30% of the population. So these are considerations na hindi naman dahil takot tayong mamatay kung magka-COVID tayo. That's siguro minimal na yung risk natin dahil with the vaccinations and the medicine available. Pero may mga other factors na hindi pa natin masasabi kung anong long-term implications nito. And that's why hindi ko rin masisisi na may mga kababayan tayo who are still very careful going out. Ako, careful din ako going out kasi hindi pa ako na-COVID over the past 2 years. Swerte ko lang naman. And I thank the Lord. Ayokong makuha yung COVID if I can help it. So kahit na i-relax lang yung quarantines at new normal, I think I would continue to wear face mask hindi lang out of habit.
Same.
Kasi malaking tulong nito hindi lang naman sa COVID pati sa flu, sa pollution, other respiratory diseases.
Di ba we were talking about it kanina rin off cam about yung nangyayari sa Hong Kong, sa China. And may mga resurgence of different variants na naman at nagla-lockdown na naman sila even if just 1,000 cases. And it's different from us kasi at 1,000 we opened our economy, etc. What lessons we should learn from this pandemic? And how can we sustain management of this pandemic, this COVID-19 pandemic, Prof?
Well, one lesson na lagi kong sinasabi even during the start of the pandemic, and unfortunately, I'm not sure if we learned this lesson, my first lesson is never underestimate the virus. And I think it happened to us noong March 2020. We underestimated it. Dahil we think, hindi naman magiging concern yan, hindi naman papasok
hindi papasok
sa Philippines.
Dito.
Parang ganon. So we underestimated it. Parang hindi natin sineryoso yung threat ng COVID. But sige, okay. We didn't have experience before, so I can forgive that. Pero ngayon, after 2 years, I hope na natuto na tayo not to underestimate the virus. May variants, may mga surge pa nangyari ngayon. May siyang long-term health impact, possibly. So there are aspects na hindi, even scientists, even researchers, hindi pa nila masasagot lahat ng mga yan. And naiintindihan ko naman, livelihood is important, economy is important, lalo na ngayon na may crisis sa Ukraine or Russia. And that's why we're happy. We support Alert Level 1 para matulungan yung economy natin, para ma-lessen yung impact, yung economic impact nitong oil crisis. But, since andyan pa rin yung pandemic, and we should not, andyan pa rin yung virus, we should not underestimate the virus. We should still keep that in mind. Sana, yun nga, unang-una yung data natin, tumigil na yung pag-report ng daily count, daily cases. Wala pang gumagawa niya sa mundo. I mean, except for siguro about smaller countries, pero lahat ng countries, they continue to report daily cases, daily numbers, deaths, recoveries. Tayo, hindi na. Weekly na lang daw. I think that is a mistake, or I think that is or I don't agree with it. Kasi the rest of the world, nagre-report pa sila ng daily numbers. And kahit kung mababa naman yung numbers natin, kahit i-report natin daily, it gives people more confidence na maganda yung situation natin. Rather than hindi naka-report, mas magkakaroon ng doubt yung mga foreigners na pumunta dito, hindi nagre-report na ng numbers ng Philippines.
Totoo. Ang nangyayari pa, weekly na yung binibigay nilang cases. Minsan, pag hindi ka magbabasa ng maayos, 6,000 na naman. Yung pala, weekly lang pala yun.
So, we're changing the mindset, pero are we ready for that? I mean, we're changing the mindset for the pandemic, pero are we ready for that? And yun nga, like I said, let's not underestimate the virus. Marami pa tayong hindi alam about this COVID.
Maraming salamat po sa inyo, Professor Guido David, for gracing Istorya Sessions. It's so nice to talk to you and mapakinggan po yung mga insights nyo tungkol dito sa ating nararanasang pandemic. Maraming salamat po at ingat po kayo.
Maraming salamat, Angela, at sa Istorya Sessions for inviting me. Mag-ingat tayong lahat. Stay safe, everyone. And thank you.
Thank you po. Sa pagpapatuloy ng pagbaba ng restriksyon, bukas na ng 100% capacity ang mga establishmento at malaya ng nakakaalis at tayo lahat, ang publiko mula sa ating mga tahanan. Huwag po natin kakalimutan na hindi pa tapos ang pandemyang ito. Let's not lower our guards down as well as our mask at gawin po natin ito pang sinasabing minimum safety protocols upang hindi po masayang ang ating naging laban sa pandemyang ito. Muli, ako po si Angela Lagunsad. Magandang hapon at ingat po kayo.